Hello, everybody. Happy Friday. We're back again. We have our special guest. I think some of you were trying to guess. Sarah's with us today. Welcome, Sarah.
Hey.
I'm going to introduce Sarah, read her long bio here, which I feel like has way more to add on to it. But Sarah Hornsby is a registered dental hygienist, oral facial myofunctional therapist, speaker, mentor, and entrepreneur. She's a founder and creator of MyoMentor, which I've graduated twice now from, a comprehensive mentorship, an online educational platform for myofunctional therapy with over 500 graduates. I think you probably have way more than that. That was as of January. She's passionate about merging technology into patient care and has been a pioneer in utilizing telehealth practices in the field of myofunctional therapy since 2014. Welcome.
Awesome. Thanks for having me. I'm excited to be here. And Renata's a MyoMentor graduate too, which I love that you guys are doing this and that I feel like this is like a family here. So, the reason you guys asked me to come on was to talk about this mouth breathing awareness thing that I've been doing for the past couple years. And I love when we were talking this morning, Lyle, you're saying, yeah, my video from last year, and we were kind of talking about that interview. And so anyways, I'm happy to share this message and I'm happy to be here with you guys. So
yes, I think that you do such a nice job with, especially this month. I mean, you didn't do the videos like you did before, but I think actually it was 2 years ago that you did an interview. I think it was every day.
Yep.
Every
single day in the month of May, I did an interview from either a dentist or a hygienist who had gone through the MyoMentor course, telling their story on how mouth breathing had impacted either them personally or someone in their family, like their kids or husband or significant other, something like that. So that's what it was for.
So why don't you tell everybody what Mouth Breathing Awareness Month is and why you decided to start this?
Yeah, it's really just, I feel like mouth breathing, it sounds like such a funny thing to care about. We all get it. We're all in this field. We talk about it every day. I mean, you guys have something called Airway Circle, which obviously is about breathing and wellness. And I think to all of us, we're kind of in this bubble where we realize that mouth breathing is a bad thing, but a lot of people don't. So this was really a campaign that I wanted to start to create awareness for my patients and for people who are not part of our little community in our bubble where we talk about this all the time, like it's common knowledge. Most people have no idea that mouth breathing is different than nose breathing. Maybe it's something we joke about, like if you're a mouth breather, you're like a Neanderthal or you're like,
dynamite.
Yeah, totally. So it's kind of like a insult to call someone a mouth breather, right? But beyond that, most people don't really know that it actually leads to bigger problems like sleep apnea and sleep disorder breathing and all these airway issues that we're always talking about. So I wanted to spread awareness about that for my patients. And so the first year I did it, I just did a social media post on either research, it was an interview, it was, just sharing information. That's all it was an informational post every day across all of my platforms. And then the next year, it was an interview every day. This year, it's been a little bit more behind the scenes, but what I've done is taken all the graduates from the MyoMentor program, the January course. They all had the opportunity to volunteer to do screenings. So we have screened, somewhere between 50 and 100 patients, all based on the volunteers, those MyoMentor students who are like new graduates, and they got to feel part of something special and bigger, and they got to get practice, talking about these things. So that was the idea, is that we could just try to screen as many patients as possible and then help guide them in the direction of therapy with, whoever they want to see.
So how do you feel like a lot of the patients interpreted the screenings? What were their thoughts?
I think they've really been beneficial. I think it's been so helpful for not just the patients, but for the therapists. Since I know the therapists more, I get to talk with them more. The patients, yes, they've got great information. Now they have something tangible to take away. They've been told that they have symptoms or they have problems or they have red flags. And the therapists have got to really connect. I've gotten several text messages and emails saying, thank you for doing this. It's been so helpful to feel like I can share this information. So I think it's beneficial for everyone. It's beneficial for me because I feel like I get to give back. It's beneficial for the students, and the therapists because they get to gain some experience talking about these things. It's beneficial for the patients because obviously they're getting screened and hopefully treated. So yeah, it's like a win-win-win for everyone.
Do you want to talk a little bit about mouth breathing and the progression of how it goes from bad to disastrous?
Yeah, sure. I think people don't realize every kid that breathes through their mouth at some point will be an adult with sleep disordered breathing, whether that's upper airway resistance syndrome, obstructive sleep apnea, snoring. I mean, it's really a continuum. So it's mouth breathing at one end, severe obstructive sleep apnea at the other end. And it all comes down to where you fall on that scale based on your resilience, based on your other symptoms, your age, a lot of other factors. So mouth breathing is a risk factor for sleep apnea and sleep disordered breathing, just the same way that smoking is a risk factor for high blood pressure or lung cancer. Or it doesn't mean that just because you mouth breathe, you have these other things, but you're very likely to develop them at some point if you don't correct that mouth breathing. So, it starts off as something like so simple, like breathing through your mouth, and it can end up as something much bigger and worse. And it doesn't, and we talked about this morning, it doesn't have to be in adults only. There are kids with obstructive sleep apnea. So it doesn't always take decades and decades of dysfunctional breathing to turn into obstructive sleep apnea. It can be existing in kids already. So that continuum can be short for some people.
Yeah, and that is very personal to me because it's not funny, but it's sad thinking back 2 years ago when we did the Mouth Breathing Awareness Month and we did the interview, and my big topic was breastfeeding and how difficult it was for me to breastfeed my now 6-year-old son. And maybe we can get into later why some people breastfeed, mouth breathe. But for him, he wasn't like always a big mouth breather. He had some nasal snoring, so his mouth was actually closed. So, 2 years ago, I didn't know any better, or not even 2 years ago, 4 years ago when he was little. And it just kind of evolved. And then I started noticing more problems with him. And that's how I got into myofunctional therapy. I remember going to the pediatrician because he's wetting the bed, he's tossing and turning. And this was after, 2 years of breastfeeding issues. Somehow he still breastfed, which is amazing, but the whole time.
But it's all these red flags that you don't know are red flags until you find out later. And then you're like, oh, wow, my kid has all these things.
Yeah.
And I had no idea these were even as bad as now I know they are. So.
Right. And then he's 3 and 4 and he's still wetting the bed. He's still tossing and turning. The pediatrician gave us actually a medication to help hold his bladder of urine, which didn't make any sense to me. I never gave it to him. They had told me it was behavioral why he was peeing the bed. So we promised him Lego cats. I mean, we tried to do everything to convince him to go to the bathroom, and it just didn't happen. So I think it was probably like last year, we finally decided okay, now you're 5. You're still wetting the bed. Now you're having behavioral issues emotionally. The kid is very, very smart, thankfully, but now he's having emotional behavioral issues. And that's directly correlated to sleep disordered breathing at night. And so we had gone into an orthodontist. COVID happened, no orthodontics. So probably the last, I think, week or 2, we found out that we did a sleep screening on him. He has moderate full sleep apnea. He has upper airway resistance syndrome, and he has surgery in a couple weeks to get tonsils and adenoids out as a start. But he was an infant, and now I look at pictures of him as a baby and his mouth is wide open. I'm like, why didn't I shut his mouth? It just closed his mouth. Why was his mouth open?
Oh man, it's so tough. Yeah, because you can see the signs now that you know what they are back, way back when, and now here you are in age 6. And I mean, obstructive sleep apnea is a big deal. I don't know how many people listening know what it is, but it's basically there's two components. Like your tongue or some structure is obstructing your airway while you sleep. So it's blocking oxygen from your brain and from your body, and so your oxygen levels drop, and that's what makes it obstructive sleep apnea. So you're actually having those lower oxygen levels. And think about that. We all joke about like holding your breath and losing brain cells or, stuff like that, like blowing
up. That's really what's happening. So I'm just thinking now, like I go to bed until like we figure this out. Every night I'm going to sleep thinking like, this sounds completely morbid, but like somebody's strangling my son. And that does sound absolutely terrible, but it is. That's what's happening, and it is sad. I'm fortunate that I have the resources and the knowledge, but so many kids go undiagnosed, and then they can't focus in school because they can't breathe. And
how many moms are going through the exact same thing that you're going through right now, and they have no resources? They don't know where to turn to. They are going to the pediatrician. They're being given medication. That's all they know. So this is why we are here. So guys, share this live. We never know who you're going to be able to reach. If it's a friend of yours or a family member or your child's teacher, who's going to see some issues maybe that we might talk about here in other kids in the classroom. You just never know who you might reach. So you guys, please share this live if you can. And whoever is watching it live with us, please do write a comment, #mouth breathing awareness. Yeah. So we all know that you're here listening to us. I do have a quick question to Al. How is your child's sleep? Does he move around a lot?
Oh my gosh. So I also have a almost 4-year-old. And if the 4-year-old comes in to snuggle during the night, it's fine. He stays still. He snuggles very cutely. The other one, he's all over the bed. Oftentimes he was flipped. And actually, I didn't even think of this until a couple weeks ago. He used to wake up from like naps in bed and he'd be on the floor. He wouldn't even be in his bed anymore. So he would almost like sleepwalk. And and obviously he wears a pull-up, but it's soaked. There's a lot of bedwetting. There's a lot of grinding. He must grind his teeth. If you asked me if he grinded his teeth, I would have told you no. I did an exam. I'm like, oh my gosh, you have wear all over your teeth. So, dental exams. I know that Sarah with the Breathe Institute, Dr. Zaghi, you guys have come up with a really quick screening for a lot of dental offices to start implementing. It's so quick. Like I did that on a patient, I think last week. And
nice. You did?
Yeah, I used it. And
cool. I love that.
Here we don't have as many resources, so it's hard to direct them, but at least it got the parent thinking what could be going on. And it's super easy to use, like a minute. It took me a minute.
Yeah.
Can Sarah tell us a little bit about the screening that I was talking about?
Yeah, it's called the Ferris 6. You can look it up, like literally go to ferrist.org. It's FAIREST.org. It's a validated screening tool, which means it's completely supported by research, and it's everything that it's using as a screening protocol is documented in the literature. We all understand, we all agree. That's what it means. And it's six things. Number one, do you breathe through your mouth or your nose? And it's like, it's got these, I wish I could like share my screen and pull it up, but it's got really easy pictures and you just tick the box, yes or no. The first thing is mouth breathing. Do you breathe through your mouth or do you breathe through your nose? Yes or no. And it doesn't even make it so specific, like, is it all day and all night? Is it only at night? Is it sometimes during the day? It's just like, do you do it? So it's that, it's, do you have signs of grinding and wear on your teeth? Do you have large tonsils? Do you have a tongue tie? Now, of course, I'm on the spot. I'm not going to remember the other two. Where,
I think.
Yeah, I said that one, I thought. I said the tonsils.
I'll pull it up. I think I can.
But you know what's interesting is that I did that for my son, and he only checked 2 of the boxes. So that tells us, like, you can have problems and not always check all of the boxes. Yeah.
Yeah, there we go. The other one, palate width, that's one. And then I don't know if they put Malin-Patty score on there. That's kind of more common.
Yes, I think it is on there.
There you go.
There we go. Nice job, Renata.
Yeah.
So, mouth breathing. Oh, mentalis strain. That's the one I forgot. So is the chin straining? Is the chin dimply? And it's a really easy tool. You can just tick the boxes, and it helps in a dental office really quickly. It's really a pediatric screening tool. It's not actually validated for adults. And you can see if you keep scrolling, all the research is listed at the bottom that's referenced. And so that's helpful as well. But
we can post a link to that as well.
Sorry, I'll say it again.
I was saying we can definitely post a link to this so people can have it.
Yeah. Mm-hmm. And that's why with the mouth breathing awareness, I just wanted something that was like easy to understand, because I think any parent can say, oh, my child is mouth breathing. They can catch it. If they know to look for it, they can start to understand that it's a small thing that can contribute or lead to these bigger things. And so it's not as complicated. Like all these things you're talking about, a lot of parents would have no idea that they're not normal. So like bedwetting and teeth grinding and all of these things that we know, they're all connected to these bigger, scarier signs of sleep disorder breathing. But just mouth breathing, I felt like is something that if I could draw attention to that as a symptom, then it would be so easy for people to then make that leap to other things. So you start with mouth breathing as this like red flag to, screen everyone for, and then you can get into the more complex stuff as need be. So that
why do people mouth breathe?
There's really 2 things. You either have a nose problem or you have a tongue problem. So your nose is blocked, your tonsils are enlarged, for some reason you can't breathe through your nose. That's one thing. The second thing is your tongue physically is tethered to the floor of your mouth, and a tongue tie, you can't get it to your palate. And so because your tongue can't elevate to your palate, it drops to the floor of the mouth, and then the mouth drops open. So there's really like one or two, door number 1 or door number 2. And some people have both. But if you don't have a tongue tie and you don't have a nose problem, you shouldn't be mouth breathing. And there are people in that situation who still are. Typically, that's when you were a kid with these symptoms, like you had allergies as a kid or asthma as a kid. You grew into an adult, you grew out of those problems, and now you have these residual habits remaining. So that's pretty common as well. Mm-hmm. What do you guys think about that?
I find that a lot of patients have habitual mouth breathing.
Yeah.
I have a patient that has experience with mouth breathing, poor sleep, anything like that. I feel like sometimes they can tell me, we check like how they feel breathing through their nose. And I do feel like most of the time they're like, but I can breathe through my nose fine right now. Yeah. And I feel like that tells me, well, you just have to relearn how to do that.
Yeah, for sure. Right? It's a habit. And this is where I think a lot of the surgeons get a little, I don't want to say off track, but it's not in their realm of thinking about. They think if you remove the tonsils and adenoids, if you straighten the septum, if you clear out the sinuses surgically, now you're fine. But for somebody who hasn't been able to breathe through their nose for decades, or even just for a couple of years, they don't know how to make that switch, and they actually do need help. And even if it's just, okay, you need to practice making a conscious effort to nasal breathe versus, if people just have that conscious awareness of it, they can change it. But if no one ever even tells them, you have to practice this, and your body has to adapt. These CO2 levels you have to adjust your CO2 levels of your body, because you feel like you can't breathe because you have a low CO2 tolerance. And that's more complicated. Patrick McEwen, I'm sure, went into all that.
He did into it. And we talked a little bit about like mouth breathing with exercising and the differences there. And I've had some patients say, well, only when I go for like a moderate walk. I'm like, well, you shouldn't be breathing through your mouth for a moderate walk. I mean, if your heart rate's way up there and you're doing high intensity workouts, you know, you
It's
are
40% of the time.
What is it? 4%?
40.
40. Okay.
During the high intensity workout.
Yeah. I knew there was something that was acceptable to breathe through your mouth.
That's good to know. I didn't know that. I didn't know that 40% number.
Yes, he did reference that a little bit as well.
But
I don't know if there's any questions coming in. I'm not sure how to tell what
y'all are welcome to post questions on here so Sarah can answer them.
Yep, happy to.
Do you want to talk a little bit about upper airway resistance?
Sure, I can talk about that. It's something that it's a form of sleep disordered breathing. So we can think of the term sleep disordered breathing as this umbrella term that captures obstructive sleep apnea, which is really bad. That means you're losing oxygen or your oxygen levels are dropping. There's upper airway resistance, which means your body's kind of in this fight flight mode. You're not actually obstructing. It's almost like you've got this high sympathetic nervous system response, this fight flight response. And so your body will preemptively wake you up. They call it an arousal, but you're just, typically people are light sleepers, restless sleepers. They typically are not the stereotypical person that we think of having obstructive sleep apnea, which is like old, overweight men. These people can be younger, fit, women, teenagers, they are not obstructing, but they're not getting into deep levels of sleep. And they're having high arousability. They're in fight flight mode and they have high sympathetic tone. So they're waking up constantly in the night. They're exhausted, they're fatigued. And if kids are doing this, they're often smaller in size because they're not getting growth hormone, which is released during stage 3 or stage 4. I can't remember off the top of my head, during our deep stages of sleep. And if you think about that in the adult application, when we get to these deep levels of sleep, that's when healing and our immune system and, our brain and everything is like recalibrating. And basically, sleep is our rest. It's our rest phase for our whole body and for our minds and everything. So if we're not actually getting to deep levels of sleep, now we have big issues. So UARS is more about fatigue, younger people. It's harder to detect. It's not going to get picked up on a lot of sleep studies. And so when people tell you they're tired and they're having issues with sleep, but they go have a sleep study and it says they're fine, these are typically people that have UARS.
Yes, I have a patient. She's like, I don't have sleep apnea. I only measured like a 1. And I'm like, well, let's see your graph. I don't want to see the numbers. I want to see the graph of your sleep cycle, because that's where you're going to see all these micro arousals, and they don't always look at those. But those patients maybe fall in the category of, is there a tongue restriction, myofunctional therapy, palatal expansion? I mean, there's probably other.
Yeah, those patients improve the most from myofunctional therapy. They can go from having, really bad sleep and a lot of issues to just changing basic things like nasal breathing and tongue posture. And they can get big improvements because they're not at this far end of the spectrum of you have severe obstructive sleep apnea, you have an AHI of 60. That's really bad. And myofunctional therapy will still help you, but you need a lot of other things at that point. Mm-hmm. UARS hasn't got to the point where it's so bad that you can still do a lot of the simple therapeutic, maybe expansion, type of things. You don't necessarily need a CPAP or some of the other things. So I think it's better to catch it at that stage than before it gets worse. I mean, obviously. So
I had a patient that just had a sleep study done also in a regular ENT office, and it came back, same thing, 1, only AHI of 1, and no, patient's fine. And they sent me the report, said, no, she's fine, she doesn't have anything. There were over 40 arousals, oxygen desaturation going all the way to 88%, and they're saying that she's fine.
Wow.
And I think sleep apnea, to have an AHI, I think it has to drop 3 or 4%. something like that. But I was talking to another dentist that said that the 3% really came from insurance bills.
Exactly.
You have to drop this. You have to be this bad to qualify for a CPAP, and then 4% I think came from like Medicaid. So Medicaid makes even less, or you have to be even worse when really all of these things. If you're treating mouth breathing as an infant and you're closing the child's mouth, you're
guiding growth and development.
And it really depends. It's looking at your total sleep also. Let's say that every time you lay on your back, you have those issues. So you have an obstruction and you have oxygen saturation. Then you turn to your side and you don't have any issues. So 100% of the time that you were on your back, you had issues. That's a problem, but it's going to divide that into your whole sleep all night long. So every time you're on your side, it's going to say, so the number is going to go way down. You really have to get somebody that's really good at reading a sleep study to help you out. To really,
what about the
also for us, that are in the field, it's really easy for us to look at somebody and see that they are mouth breathing. We can spot it from a mile away.
Yeah.
And it's a train. It takes time. Your eye gets trained in that, and most people don't realize they're doing. My husband was just recently stressed out with something, and he kept going, I'm like, stop mouth breathing. And he wasn't paying attention. You didn't even know he was doing it, But gosh, that gave me anxiety just watching him go, I'm like, stop.
Yeah.
So most people, when you say that, do you mouth breathe? No. Oh my goodness. Like you said, it's such a bad word, but it's not. And most people, I don't think anybody is 100% mouth breather. I don't think that exists. Most people are mixed nose breather and mouth breather, and only a few people are able to breathe mostly through their nose. 100% also. You always have that safety, of course, of breathing through your mouth in case you need to. But even if you don't think you're a mouth breather, but you have some symptoms, and we can talk maybe a little bit about the symptoms, what to look out for in children and then in adults. We would recommend getting an evaluation with a myofunctional therapist to rule out and to make sure. The difference of seeing a myofunctional therapy first is that, like, we are the middle puzzle piece. We are connected to all these different specialties that we can refer this patient to. So we're going to check nasal breathing. If you feel like there's an obstruction, you're going to go to an ENT. If you have enlarged tonsils and adenoids, we don't know about adenoids, but we're going to send you to an ENT. But if you go first to an ENT, maybe they'll never send you to myofunctional therapy.
That's true. Yeah, for sure.
For us to work together. So if you guys that are watching know anybody or think that you might have a mouth breathing issue, contact a myofunctional therapist around you, and they'll be able to guide you to that journey. We have a couple questions, guys. Leslie said, can you go into the vitamin D and B12 influence on sleep? I know a doctor that requires this for all of her pedo patients. Do you know anything?
Boy.
Yeah, that's a
complicated one. Do you guys want to go for it, or do you want me to go for it?
B12, I don't know very much. Vitamin D, we all know how amazing and important that is for not only sleep, but everything.
Yeah. And I think the vitamin D too depends on where you live. I live in like way upstate New York, and we're dark for the majority of our time. So I think that sometimes with, you are upper airway resistance or mouth breathing, you could have a lot of very similar symptoms of vitamin D deficiencies, right?
Yeah.
Definitely there's some correlation there. So I think that kind of depends on where you live. But the doctor requires that for all of her pedo patients. Interesting.
Well, I think she's probably referencing a lot of Stasha Gomaniak's work. So Stasha Gomaniak is a neurologist, I believe. She's a physician, and she has extensively researched vitamin D and vitamin B12. And it has to do with your gut health. It impacts our hormone systems. It impacts our sleep, our jaw and bone structure development. It's like a really big deal. I'm not an expert in this area, but I've listened to lectures by Stasha Gomeniak, and I know she's amazing. If you look up her website, she's got lots of information. What she says is that we all are deficient. It's just like in our modern society, we all have myofunctional issues and airway issues. We're all deficient in vitamin D, and often vitamin B12 is linked to that. So she talks about getting tested, and she also says that our standards for testing, and we'll know this, we understand this from dentistry, like what we think of as a wide palate is actually narrow in probably the grand scheme of things. What our medical system says is normal for vitamin D levels is actually, according to her research and the stuff she's developing and protocols and things like that, that's even low. So I can't remember what the standard levels are. I want to say it's like 20 to 40 micrograms, or I don't remember the measurement, but she's actually saying more, it should be like 60 to 80. So she's saying like we all should be really testing this and paying attention to it because it affects our sleep a ton. So again, I'm not an expert in this area, but I know Dr. Gomeniak is, and she's got really cool stuff if you guys want to look into that more.
Well, we know vitamin D affects your teeth and gum disease and all of that too. So there's a lot that goes with the mouth.
Next question by Ashley. What is your next step after you further interpret the sleep study and find more issues that were initially detected? I don't have a great referral.
I mean, I can talk about it. I think it's hard for us as myofunctional therapists. We're not doctors, but we work with teams of dentists and doctors who hopefully we have in a network, and we can say, hey, like, I see red flags. I know how to pick up on symptoms. I know how to look for red flags, but let me send you to this doctor. So that's typically what I would do. I'm guessing, is Ashley a myofunctional therapist, or is she like a mom, or?
Probably a patient. But also, I think to further interpret, if you contacted a myofunctional therapist, because we have such a big network, a lot of providers can do telehealth, consults just to read over your sleep study with you. There's maybe other imaging that you could have done to help them. So you don't always have to find somebody directly in your area that gets this, but at least have somebody reading this information that reads it the way, we're discussing.
And I think, I'm hoping if they had a sleep study that somebody interpreted it for them initially, and then they're hopefully just looking for more information if the results aren't what they thought it should, or it doesn't seem right.
That's okay. And not detected as much stuff. Kind of like my patient that said, you're good, but I saw some more stuff. So what my patient is doing, she's making another appointment with a more an ENT who I referred her to that understands what we're talking about here. So they're going to read the same sleep study and be able to guide her in what to do next.
Yeah. So I actually can say after that, she's looking for, so she said, and I'm not sure how to get my myo patients to the right provider. So, you can reach out to us or I, and we can try to help you find somebody, as well.
But very soon.
Yeah.
The website's ready. You guys are going to just be able to guide your patients to the website. I'm going to have a free directory. So you'll be able to find all Airway providers there. Nicole had asked, what was the 40% reference related to exercise? During high intensity exercise, it is okay to breathe through your mouth, but only 40% of high intensity workout. I'm pretty sure I read that, the Patrick McEwen's Oxygen Advantage, but it was the first book I read years ago, so don't quote him on that. No, don't quote me, don't quote him.
This new book is fantastic. I don't know, Sarah, if you've gotten to it, but it's very good.
No, I haven't.
Very good. I haven't finished, but it's very, very good. So what are some symptoms? What are some symptoms that we should be looking at for children? Let's start at children.
I think, it seems kind of obvious, or I guess it seems really common, but if you're noticing your child has a lot of crowding, crooked teeth, that can definitely be a sign that they're mouth breathing. Basically, the tongue is not supporting the palate's narrowing. As the palate narrows, the teeth don't have space. And so that's something that any parent can look for. Baby teeth should have a lot of space between them. If you're seeing baby teeth touching, that's a sign that your kid probably has some, not just orthodontic issues in their future, but there's definitely myofunctional issues going on as well. So look at your kid's baby teeth. If you're an adult and you're looking for like red flags, do you have a high narrow palate? That's, something we can all look in our own mouths and we can see. Do you know you have large tonsils, whether you're an adult, or can you look in your kid's mouth and see giant tonsils in the throat? Has your doctor said that your son or daughter has large tonsils? Has the dentist said anything, but they say it's normal? I would say, do some investigating if you see that your kid has big tonsils or gets a lot of like colds and they're sick all the time, stuff like that.
One thing I didn't know is that sugar increases your mouth breathing. And I noticed that on my baby this past, let's say 3 weeks, that he has had more sugar than normal. And he has his mouth open at rest all the time now, more than he did before. So we got to cut that down. So yes, it's incredible how much of a poison, a delicious poison sugar is.
Delicious poison.
It tastes delicious, but it's so bad. It's so bad.
I know. So
body from, absorbing vitamins. I mean, this is a topic for a different day, but mouth breathing, can be affected by sugar.
So also when you were talking about, the high narrow palate, that comes back to the low tongue posture that you were talking about, tongue low in the mouth. So the tongue needs to rest so that it can grow the palate wide. It needs to be up in the roof of the mouth. So again, if your child has that high narrow palate, their tongue is probably up, not up where it should be. And that could be tongue tie, it could be, other things, but the tongue has to support, your nasal breathing, basically.
Mm-hmm. So the size of the tongue is genetic. Your tongue is going to grow until it's supposed to grow by following your genetics. But the size of your face, it's not. So the skeletal structure is going to grow based on several things that we're talking about and breathing. Nasal breathing is really going to affect the skeletal growth. So a lot of times we hear, that tongue is huge for that mouth, but maybe the mouth didn't just grow as much as you were supposed to.
The mouth is too small for the tongue, right?
Exactly. Just like the teeth.
Yes.
How about some symptoms in adults? What should adults be, paying attention to?
I think adults can be more aware than kids. And so it's a little easier to just observe yourself as an adult and start to just, like you were saying before, Renata, so many people, it's always the first thing. Nobody admits to actually mouth breathing. So if you're an adult, you can start to tune in and just pay attention to your lip posture. Do your lips rest apart? Do you mouth breathe at night? Do you wake up with a dry mouth and a dry tongue, and you have to drink water? If you're mouth breathing at night, that's a reflection that you probably are during the day as well. You just don't notice it. So people will always admit to mouth breathing at night. They might not admit to snoring, but it doesn't sound weird to mouth breathe at night. And it's actually not good. So if you're mouth breathing at night, that's a red flag for sure that during the daytime, you're probably dysfunctional breathing as well.
One way that you can check is whenever you go up flight of stairs also, if you really get winded. And it's same thing with whenever you're exercising, the second you open your mouth, you're going to get tired. Mm-hmm. Just because all, CO2 and everything changes, and all of a sudden you don't have as much energy. So right now, whenever you go for a walk, and I started something on Instagram, let's walk or run for 1 mile, month of May, and hashtag mouth breathing awareness.
Ooh,
1 mile
like that.
closed, because I got to post a picture with your mouth closed. I think all of us should start taping in the gym for 1 mile walk. Everybody's going to start paying attention. They're like, what are those crazy people doing? They're going to look it up.
Maybe we need tape that says like mouth breathing awareness so that people can read it and they're like, oh, that's a thing. There's tape on your mouth. Yeah, that's actually a good idea.
But try, all you can do is just try to start exercising with your lips closed and see how much more endurance you're going to get and how much stronger you're going to get. It's really incredible how it will change.
I also think that, when you are mouth breathing and then unfortunately it wasn't addressed and it's evolved into other airway issues, and then it evolves into sleep apnea. So now you're not sleeping well, so you're tired, you're not eating well, you don't have the energy to exercise. So then you're overweight and you don't have the energy to exercise, and then you're stuck in this cycle of, okay, I just need to breathe better, and then you can go and exercise and, make yourself a healthy life. But I can't imagine being exhausted and then trying to exercise and be healthy, so it almost doesn't matter how many fruits and vegetables you eat. If you're not breathing right, it's going to affect your whole body.
And we got to remember, we always talk about the nose. What is the nose? The nose has 3 jobs. It warms the air, humidifies the air, and it cleans the air. So all of these germs that we're constantly breathing in, this is the filter of your body, guys. If it's not going through this, it's bypassing your first, line of defense, against all these germs out there. If any of those pathogens go into your mouth first, it's going to land straight on your tonsils. So for those people that have strep throat, over strep throat, or, just upper respiratory infections and all these issues over and over and over, people that are always sick, those kids that are constantly running with runny nose, ear infections, all of these things are related. So yeah.
What about, Sarah, I wanted to ask you, I've had a few parents, and actually a new adult person tell me that they only snore when the child's exhausted, or they only snore when they've had a long night or alcohol. And so my thought is okay, so the child's exhausted, but how would that cause them to snore? Or do they not really coincide? It just happens to be a coincidence?
I think, so there's a couple scenarios going on that can happen. With alcohol, everything's just a little bit more relaxed. All the tissues are a little bit more, floppy. So that's with alcohol. And a lot of people don't snore until they have a couple glasses of wine or whatever, and then they definitely do. Or that's at least what they think. With kids, I think, and adults actually, any little bit of extra inflammation. So whether it's sugar, like Renata was talking about, whether it's they've just got a slight, maybe it's gluten, maybe it's something in the diet, maybe they've just got a little bit of seasonal allergies going on. Anything that pushes them up just over that threshold of what their airway can tolerate without snoring, a little extra inflammation in the body will push them over the edge. So I don't know, if they're extra tired, what that would be, but maybe a lot of this extra tired stuff comes from they were at a birthday party all day, they had a ton of sugar, they were running around like crazy, and now they're snoring. I'm not really sure. I've heard that before too, but I look at it as extra inflammation or just something extra that pushes them over the edge of where they wouldn't snore.
What do you find are some things that cause a lot of inflammation? So sugar, obviously, sugar is disastrous.
Yeah, it's different for every person. Yeah. So this is where a lot of the food sensitivities can come in, where it's not a true allergy, but if you have some sensitivities to dairy and egg and gluten, and you've had a lot of those things, and that can create higher levels of inflammation in your body. It can be environmental, like if you have seasonal allergies, pets, that dairy dust dander thing I talk about, anything that's increasing that inflammation. And I think it can be a lot of things, if your immune system's worn down and now you're you're pushing it through. It's before when we all used to travel all the time, people would say, I always get sick when I travel. Well, part of that is because you're on airplanes and, it's gross. But the other part is you get more tired and your body just gets worn down. If you're going through a lot of different time zones, international travel, all these little things, there's lots of little things that layer, and then all of a sudden now you're sick. Your immune system, you just got pushed to that basically past the point you could tolerate. And so once you can only be so resilient. And so you hit that threshold and then you get sick, or you hit that threshold and that's enough inflammation to make you snore or to make you have breathing issues. So it's kind of comparable. I don't know if that helps.
So probably something similar to allergies. If you're mouth breathing, everything's getting, sucked into the tonsils. So a lot of people that have chronic allergies are probably also mouth breathing instead of using their nose to filter pollen, dust, whatever else there might be.
Mm-hmm.
Right.
Yeah. Yeah. So, I mean, there's a lot going on with that. I think, to make it really practical, I always just try to, go back to things like just do simple tests. If you're not sure if your kid is mouth breathing, do that lip seal test. I know that's part of that Ferris 6. Hold something between the mouth or between the lips, like a tongue depressor. I have one here. Or put a little piece of tape or put in a mild munchie and just see, can they tolerate that for 3 minutes? That's an easy screening tool. So 3 minutes is the threshold. If they can't get past 3 minutes without taking it out or kind of wiggling around or being uncomfortable, then they either have a pretty low tolerance for that CO2 and breathing, or they have an actual obstruction that should be checked out by an ENT. So I think start small, start with 3 minutes. If they can do 3 minutes, then try 5. If they can do 5, then try 10. And the more time that you can get them to spend nasal breathing, it all adds up. So I know.
I like to do the game. I tell them to put water in their mouth. Let's see how long you can hold water in your mouth.
Yeah.
And mom does it too. Try to do it with them. Have all the siblings do it. Everybody you've seen at the dinner table, like that, the child doesn't feel like they're being, called upon. Like it's, you're the one mouth. But let's all do it together. Let's see who can hold it longer. And
if your child's probably eating super easily, and like they're eating with their mouth open, we always go right to it's not polite to eat with your mouth open, but if they can't breathe, then how are they supposed to eat?
Exactly. If you're telling your child over and over, close your mouth whenever they're eating, it's because they're mouth breathing.
Yeah. And I think the other important thing for parents to know is that just like we have conversations around you have to brush your teeth, you can't eat ice cream for dinner, you have to take a bath, you have to do all these things that we all have to do. It's the same thing with we all should breathe through our nose. We have to, blow our nose if we can't breathe. We have to remember to close our mouth and put our tongue up. These are things that one, program with a myofunctional therapist isn't necessarily going to fix forever. If I do myofunctional therapy with a 5-year-old, that might be good for that. But as they go through all their, changes and growth spurts, and as things happen in life, these should be things that all parents have conversations about all the time. And we just don't have that. And in our society, it's not, we might talk about brushing your hair, brushing your teeth, eating healthy, but we don't talk about how breathing healthy and tongue posture is just as important as sitting up straight or whatever. So I think these need to be conversations that parents just need to know. This should be a normal family conversation. It shouldn't be like you have to see a myofunctional therapist, they're going to cure you, and then you never have to think about it again.
This is interesting. I remember to this day, my grandfather, we're all sitting on the dinner table, and he would pick on us if we had our mouth open, or just whenever we're talking, just sitting there with our mouth open, and he would say, "A fly is gonna go in your mouth." There's a Portuguese saying for that. And I grew up listening to that, but not knowing that it was, our elders going, "You need to breathe through your nose, close your lips."
Yeah, that's cool.
I did it to my child. She was so scared. Zoe to this day goes, "Oh, I don't want a fly to go in my mouth."
Yeah, maybe I need to tell my son that, my youngest. Sometimes, if his mouth is open, I'm like, "Close your mouth," and I'm like, "You little," just so now I'm gonna say you're accidentally gonna swallow a bee and it's gonna sting you.
That's funny.
Yeah, he's a little.
Yeah, I mean, you guys are both parents. I'm not, but I work with a ton of parents. But there's just things you constantly have to tell your kids. And, they're sitting like this, all right, sit up straight, There's just things that I think we have to have conversations about around the tongue posture and breathing. And I don't know, what are common things you guys have to nag your kids to do?
Everything.
Yeah. Do we not have to nag?
Life.
Totally. So this is another thing. And, it should just be thought of as the same way. And I wish that the myofunctional therapist felt a little bit more empowered about that, because We can give people the tools. We can have the conversation. We don't live with people. We don't watch their child grow, like these things, we need to change the conversation around it, really. So,
well, and I think that's why a lot of myofunctional therapists that have children arrange for another myofunctional therapist, Renata, to treat their child. Like, you treat your daughter, you treat my son, because it is hard as their parent. And we know even more than the average parent. So we're like, racking our brains over why are they not doing this, but why do they not do half of what you tell them to do? So, yeah.
Super sassy.
I try to do as many games as I can.
To be 4 years old, for her to go to sleep, and I would, see the show's mouth breathing. I'm like, watch your mouth, breathe through your nose. She's like, Mommy, I'm going to breathe however I want to breathe.
Yeah,
okay. So yeah, having kids is super fun, Sarah. Just like
yeah. Yeah, well, I hope this is a helpful conversation for people. I mean, again, that's the whole point, and that's why you guys are doing the Airway Circle stuff. That's why, yes, I have my practice, but I always like to spend the month of May focusing on just drawing awareness to this topic. So, maybe we'll have to plan something even bigger for next year, get like a whole bunch of people together and, have some sort of mouth breathing awareness extravaganza. I don't know. But yeah, I think it's an important message because it seems like something that is obvious, or that it shouldn't matter, or that it's so simple, like who cares? But it's such an important risk factor for all these other big things, and that's what matters. So
that will happen. It's just a matter of time. So
Definitely.
If your child is my child and has these issues, if I didn't investigate this and treat him, I can't imagine at 30, 40, how much worse. It's just going to get worse. It's not going to just magically, oh, he doesn't have sleep apnea anymore. Oh, he can breathe normal,
So what can these moms do? Because we hear moms all the time going, I just took my baby to the pediatrician because it was mouth breathing, and the pediatrician said it's normal and it's fine. So starting at a baby, what do you recommend moms do if they notice their babies are mouth breathing?
For babies, it's not my area of expertise. I will tell you guys that. But you have to make sure that they're hitting all their growth milestones. If your baby's mouth breathing, you can close their mouth, but you also have to ask why. What's going on? What'd you say, Renata? Sorry.
Who should they contact?
Find dentists who specialize in infant frenectomies. They're going to have resources. Find cranial sacral therapists, lactation specialists. At that age, babies need a lot of times body work. Babies can't do myofunctional therapy. They might need feeding therapy, lactation consulting. Really, breastfeeding is myofunctional therapy for babies. So if we can get breastfeeding, awesome. Some moms can't or don't want to breastfeed. So then what can we do to support them? But I think awareness, again, is the big thing. Knowing that if your baby's mouth is open and their tongue is sticking out, that's not normal. We see babies doing that all the time. So just knowing that is empowering, and then you just have to kind of find the professionals who can help you. So you can start screening for trying to figure out why. Are there allergies? What's happening?
And what age do you start treating them, Sarah?
I see kids as young as 3. So I've got 4 therapists who work in my practice, and we've got one who specializes in that. We call it the mini myo age group, where it's like 2 to 5. And it's very different working with kids in that age group. Really, we can give them things to try. We can give the parents things to try with them, but they don't interact necessarily the same way that an adult or an older child will with you. So, a lot of it is parent education. It's giving them activities to try even when you're not there. It's for us, we make a lot of referrals, and we try to be that support center. Like you're saying, the myofunctional therapist is in the center. We try to, figure out who else do they need to see. Is it an OT, a PT, a SLP, a dentist? How do we find the best support for that 3-year-old? And then while we're finding that support, what can we do just to get their mouth moving? What can we do to encourage nasal breathing? So we're doing simple things, but it's really the same concepts and theories that we do with our adult patients. It's just not so structured. It's not so predictable. We more go session by session and see how the parents and the kid do.
Perfect. I just wanted to clarify that because we get messages all the time about moms who have 7-month-olds and, you know, little babies going, I need help from my functional therapist. So I always guide them, okay, how about an IBCLC or an craniosacral OT or somebody else that's in, you know, that can help you with that. But a lot of us do not see little babies. We start around 3, 4, 5 years old.
Yeah.
So and if your older child is mouth breathing, then contact my functional therapist.
Yeah, and when we're working with kids at that age, really what means it's like true myofunctional therapy or oral facial myofunctional therapy, to be correct, is something that you can do where the patient can interact back with you. So you give them an exercise, they can perform the exercise, they understand why they're doing the exercise, and you can communicate back and forth with them. If you're working with babies, a lot of times you're initiating reflexes like the suck reflex. You're doing massage, you're doing stretches, you're doing oral motor exercises, and those things are best done by somebody who's in that scope, you know. So the speech pathologist, the occupational therapist, the lactation specialist. So but what we do, like if you just are trying to get your kid to click their tongue and pop their lips and they're 3, that's a myofunctional activity. And you know, it can be fun and parents can get it, you turn it into a game at that age, really.
Definitely. Are you doing anything special for the month of May?
Am I doing anything?
Yes, about the mouth breathing.
Well, I mean, gosh, the screening, that's been our big thing. So, you know, just trying to screen as many people as we can. That's really what's setting.
Are you still doing the screening, Sarah? Are you still doing screenings?
Yeah, we are. So if anyone's interested, reach out. So Saini is my basically patient care coordinator, and Megan is the lead myofunctional therapist at my practice who's running everything. So if you reach out to us, it's hello@faceologyomt.com, but you guys can link. I'll give you guys all the links if anybody wants to get in touch. You can email me directly, Sarah@myomentor or Sarah@myfaceology.com. But yeah, they're really setting up all that stuff, and it's been really successful so far. It's been fun. I think that's really what's made this month stand out from, you know, I've tried to do something slightly different every year. So the big thing this May is the free screenings and trying to get as many free screenings as we can.
That's awesome.
Yeah.
That sounds great. Any last words?
Any last questions?
Does anybody write your questions? Why don't we give it a few seconds, because there's usually a delay when they type Can you put your emails in the chat? Okay, we can do that. It's here.
Yes, I just did. I'm not sure if it goes on the group or the page, but it's on there. I think it's on the page. I adore
Sarah. Why don't you give us 3? I adore Sarah. Don't we all?
Aww.
It's great. Why don't you give us the 3 main takeaways that you could talk to a parent or even like an adult patient? You know, we have a lot of myofunctional therapists. I think everybody in the airway field feels the same way about mouth breathing. I don't think that they would be in this field if they didn't know all of this information. But for a parent or a patient, what are like 3 main things that with mouth breathing awareness that you would want them to know?
Yeah, I would just say, number 1, know that mouth breathing affects sleep and sleep apnea and sleep health, basically. So that's number 1. Know that it can connect quite a bit. So people don't make that connection. They don't understand it. And so if you can just know that if my child is mouth breathing, there's a risk for these sleep sort of breathing issues, that in itself is information that it's actually hard to find. So know that. Know that if you're mouth breathing, you know, finding a myofunctional therapist is really the key. I love what Renata said. We're the center. I talk about that too. I'm like, I'm the traffic director and I can direct you where to go. I can't do everything myself, but I know the people who to connect you with who get what I do. That's the important thing. Like you can't just go to any dentist or any ENT because most dentists and ENTs have never heard of anything that me and Renata and Lyle are talking about. This is not, we would love it to be mainstream, but it's not. This is like None of us learn this in school. None of us have this as part of our like traditional education. So anyone who's in this field has had to do a lot of researching and extra education. So just know that finding the myofunctional therapist will usually be kind of the path to open those other doors for you if you need help. Number 3, I think, think about breathing issues. What breathing issues does your kid have? Asthma, allergies, large tonsils and adenoids. What's affecting their breathing that you might think is normal, because a lot of kids have asthma, a lot of kids have allergies, but the bigger implication is that those two really, really common things lead to mouth breathing, and mouth breathing leads to all these other things. So, if you could just know those 3 things, I think those are great takeaways.
And even though things are common, they're not necessarily normal, right?
Exactly.
That is so
Awesome.
true. Sarah, thank you. Thank you.
Thank you guys.
Accepting our invitation. You're always such a good person to be around. Not only a professional, but you are so sweet and you give so much. We really appreciate your time and your knowledge. Thank you for being here.
Yeah, thank you guys. I really appreciate you having me on and wanting to give me a platform to share this message even further. So thank you.
All right, everybody listening, make sure you share and tag Sarah and hashtag mouth breathing awareness. We'll see you guys actually Sunday we have Dr. Jasmine Elmore on Clubhouse at 1:30 Eastern Standard Time, 1:30 p.m. And then on Tuesdays and Thursdays, we have our regular clubhouses with some awesome, this week, every week is awesome. But this week, we also have some awesome topics. You guys are not going to want to miss it. And then on Friday, we have another live with an amazing speaker. I'm not going to say who it is just yet. But anyways, if you guys have any questions, any concerns, or any advice for us, we are here really to serve you. So if you guys have any recommendations for Airway Circle, please send us a DM. And if you'd like a free screening with Sarah, there's her email. We're also going to post it on our Facebook page. Thank you all for listening. Thank you all for being here. Have a wonderful weekend. Bye-bye.
Bye.